Is hair transplantation for you? Hi, I'm Dr. Angeline Yong, a board-certified dermatologist and dermatologic surgeon specializing in hair loss and hair transplantation. And in this following video, we're going to talk about some key points and pointers about hair transplantation and whether it is a suitable option for you. Hair loss affects 70% of male patients and up to 40 to 50% of female patients at various points of time. Now, with this high prevalence, we have to ask ourselves, what are the number of factors that contribute to hair loss? Hair loss as a big category can be contributed to by a number of factors, and sometimes it is a combination of these factors that gives rise to the thinning that you experience or the increased shedding that you experience as well. Commonly, there are genetic factors, and this is most commonly going to contribute to a factor known as androgenetic alopecia. In male patients, we call that male pattern hair loss, and in women, we call it female pattern hair loss. This is due to increased susceptibility to dihydrotestosterone, which is a byproduct of testosterone formation. It is this DHT that makes the hair follicles more miniaturized over time, so the follicles actually go from a terminal size to intermediate and to vellus or baby hairs, giving rise to finer, weaker, smaller hair follicles. Now, there is also other factors such as hormone imbalance, like thyroid imbalances, both high and low, can give rise to increased thinning and increased shedding of hairs. Mineral imbalances or mineral insufficiencies, for example, such as iron and zinc, can also contribute to poorer hair growth and increased shedding. Stress is another major factor, so now increased stress in terms of physical illness, such as a bad bout of dengue fever or even COVID, can give rise to stress shedding or telogen effluvium in the acute phase 2 to 3 months after your illness. And of course, let's not forget other factors such as surgeries. This can give rise to increased physical stress and increased telogen effluvium as well. In summary, there's really a host of various contributing factors that gives rise to the increased thinning as well as increased shedding that you see happening in your life. So if this is affecting you, don't forget to check in with a proper specialist to first determine the number of contributing factors and do some investigations to really correct every single contributing factor. Now, if you only correct one factor, sometimes you do not get full comprehensive optimization of your hair loss and results may be suboptimal. Male and female androgenetic alopecia is probably one of the most common types of hair loss disorders that we really see presenting to us, and it affects everybody at some point of time in our life. Sometimes in older patients in the late 40s to 50s or 60s, they then classify this as age-related thinning, but really it is a form of androgenetic alopecia, but it's basically onset maybe later on in life. If you see this thinning happen earlier on in life, like post-puberty, when you're 18, 19, 20, then this sometimes causes more alarm because it's happened out of proportion in terms of the age group and the severity. However, AGA is a continuation and a spectrum, and this ranges from mild, moderate to severe. And in male patients, we use the Norwood-Hamilton classification from grade 1 to grade 7, and basically it is progressive. So in male patients, you typically can see early thinning happening in the frontal temporal zone. You can see the corners recede. You can also see it happening over the vertex of the crown. And then sometimes over time, this merges into a full column or full passage of baldness on the top of your scalp. Now, this happens progressively over time and sometimes a little bit more accelerated if there is increased genetic susceptibility to DHT. It can happen in an earlier age group, and also if there's maybe excessive production of male hormone as well. And also certain lifestyle factors that may increase the production of testosterone, such as gymming, whey protein, for example, may also contribute to increased testosterone production and downstream DHT conversion. In female patients, we see it slightly differently. Sometimes in women, we see a frontal predominance pattern, but commonly we see a widening of the part line on the scalp. We see this widening of the part line happening over time, and we classify this under the Ludwig classification of grade 1 to grade 3. So male and female pattern hair loss present slightly differently, but principally are the most common forms of hair loss that we experience in our lifetimes. Hair transplantation is a surgical technique used to restore an area of hair loss. This typically can happen over the frontal hairline, the crown, the mid-scalp, for example, depending on the area of loss and extent of hair loss. Typically, this involves transplanting hairs from the safe donor zone or the SDA area, which is typically at the back of the scalp, what is known as the occipital scalp, as well as part of the temporal scalp region. So the doctor would harvest grafts from this SDA zone where the hair follicles are actually dihydrotestosterone resistant or DHT resistant hairs. Typically, these hairs retain the same characteristics as they would in the original zone where they're resistant, even when they're transplanted forward to a new area such as the frontal scalp or mid-scalp. So this makes them then survive the onslaught of DHT even in subsequent years in the new area they're transplanted to because of this principle of donor dominance. Now, the options for hair transplantation are largely two. You can have the option of follicular unit transplantation or strip harvesting for short. This involves harvesting a linear hair-bearing skin from the back of your scalp and sometimes from part of the temporal scalp as well, and stitching up the donor area. So this gives you a long linear scar. We will go through this in more detail in our subsequent video. But subsequently, these harvested grafts are then transplanted forward into the recipient site after first slivering and processing down into individual follicular units. Now, the second, more popular version today is known as follicular unit extraction. This involves harvesting individual follicular units, which are individualized at the back of your scalp, single, double, or triple hair units, and then transplanting them forward to the recipient site. Now, both FUT and FUE can be successfully used either singly or in combination for both male and female patients alike. And this depends on a number of factors such as the laxity of the scalp and certain lifestyle preferences as well. Do note that the technique of implantation is largely the same for both strip and FUE. The main difference between the two is really how you harvest the grafts. But in principle, they can be both used to transplant into an area of need such as the frontal scalp or even your crown. As with any surgery, there are always some risks involved, even though some of these can be well controlled when handled with the right practitioner. Typically, this includes bleeding risk, infection risk, and also poor healing, such as increased scarring. This can happen especially with FUT or strip harvesting. If there is too wide a strip harvested, the scar can actually widen or dehisce. This is less likely the case to be in FUE transplantation. However, there can also be graft failure as well in both techniques, so there can be poor survival of your grafts, and it's important to optimize this to ensure good results. First and foremost, let's talk about hair transplantation and who is suitable for. As mentioned, there are two main techniques, FUE and FUT. Now, FUT or strip harvesting is most suitable for patients who have longer hairstyles and can hide a long linear scar. Secondly, it also is more suitable for patients who've got a flexible scalp. So if there's very poor mobility over the back of the scalp, then there's not enough give for the strip of tissue to be harvested adequately from the back area. Generally, it's also important to first delineate the kind of condition that you're transplanting into. If you are a male patient below the age of 25, for example, and suffer from very rapidly progressive AGA, then it might be advisable to first stabilize your underlying medical condition first with other medical therapies, slow down the hair loss before proceeding to a hair transplantation. I also want to stress that it's very important and paramount to also delineate if there is any underlying scarring alopecia that is not actively being managed or is currently in an inflamed status. If a patient has active shedding and has active AA, she's also not suitable for hair transplantation at that juncture because that can also give rise to autoimmune attack on the transplanted follicles, and that inflammation and trauma can give rise to a collapse of immune privilege in that area. And then for FUE, this is suitable for a wide range of patients, largely because of its faster recovery time, because the harvested areas basically heal up without any stitches, so it re-epithelializes within 5 to 7 days, giving rise to a rapid recovery as well as earlier return to work and physical activities. It is hence very suitable for male patients who don't mind shaving the back of the scalp for the donor harvesting, but in women it may be a little bit more tricky. Hair transplantation is about managing expectations against what donor area you have. So if you have very extensive hair loss, for example, in a male patient with maybe grade 5 to grade 6 Norwood-Hamilton score hair loss, which affects a big area of the scalp, and a very thin donor area, then we have to manage expectations because the donor area may not be sufficient to cover the density that you would like to achieve on the top of your scalp. So it's oftentimes important that your practitioner assess the recipient site and the donor site to first delineate the expected area of transplantation and also the available donor and the available number of grafts that they have to work with. So if you have very thin donor areas, sometimes you need to manage expectations by discussing with the patient the area of priority. So we will first work in the area of greatest cosmetic importance and try to focus on rebuilding this area to reverse the grade of hair loss, basically back 2 or 3 steps. So if you already have a grade 5 hair loss and we want to move backwards to at least a grade 3 or 2, we cannot first work by restoring the frontal hairline and pushing it forward. It does not make any anatomical sense that you have hair loss that happens in that order and still retain a good hairline. So it's important to manage expectations, first understand the area you need to cover and the donor you have available. If there's not enough donor, you have to work within your means to transplant an area that makes the most common sense and the most anatomical sense to the patient to give them greater value for the amount of graft that they have. It's also important to also ascertain then with patients what extent of improvement they want. So if there's unrealistic expectations and they expect a full crown of hair and they do not have enough donor, then it may be advisable to tell patients that up front. Now, the other thing to note also is the recovery process. With FUE, for example, as I mentioned earlier on in this video, you actually can recover the donor area within 5 to 7 days because the recipient or the donor sites basically close up on their own as there's no stitching required. However, the recipient site needs further care. There will be some crusting that develops in the first 1 week to 10 days. Sometimes we will bring patients in to clean the scalp and to also remove some excessive scaling. And then you will see that maybe in the first month or so, the hairs will go through a winter state where the hair follicles will release and go into dormancy. And this can be quite stressful for patients if you don't tell them beforehand that they will experience this shock loss and this period of time where the hairs go into a winter cycle. And this then proceeds with months of waiting. So from the first month, you start to see like a loss of the hair follicles that you transplanted over the second month to third month before the new wave of hair start growing in again. So typically a recovery phase for a hair transplantation may take up to 6 to 9 months post-op for you to ascertain the full recovery process and the success of your hair transplant. So again, this is a very slow patient waiting game. Hair transplantation is a long procedure and also a long recovery phase. So while you may go back to normal activities after a week to 10 days, typically there is still that waiting period for your hairs to fall out and to grow in all over again. So in summary, the whole goal and aim of hair transplantation is to help our patients achieve a fuller crown of hair so they have more confidence in life as well. But this can also be achieved with other medical adjunctive therapies, and it's good to consider this as part of a whole. So this can include treatments such as topical oral minoxidil, oral and topical DHT blockers like finasteride or dutasteride, spironolactone in women, as well as other adjunctive treatments like microneedling treatments and low-level laser treatment as well. So in total, this holistic approach can help patients achieve a fuller crown of hair without excessive utilization of surgical hair restoration techniques. At AYD, we believe in a holistic approach and a 360 approach in managing hair loss disorders. So while hair transplantation as a surgical technique is one option that we have in our toolkit, we always work with our patients to first stabilize their hair loss and work through their lifestyle preferences. So this can range from, as I mentioned earlier on, topical therapies to oral and also adjunctive therapies before moving on to hair transplantation. We also like to ascertain and plan ahead for our patients so that we can proceed with managing a patient over their lifetime. Thank you for watching until the end of this video. I am Dr. Angeline Yong, a dermatologist and a dermatologic surgeon who subspecializes in medical and surgical hair restoration techniques. Stay tuned to our next video as we deep dive into FUE and FUT and the differences between them. Now, if you have a question for us, don't forget to drop it in the comment section below and follow us on our YouTube channel.